Yeah, how do I treat cervical radiculopathy? And really, you could include lumbar radiculopathy. I'll be honest, most of the folks that come here with that diagnosis, they don't have it. And I'm a fan of EMGs. So, I mean, I think, we'll get emails from all over the globe, and some folks, like if you're in Taiwan and you're thinking about coming to Caring Medical, well, I don't want you to come from Taiwan to Caring Medical in Oak Park, Illinois, unless you're a great candidate for prolotherapy. So if the person has more arm pain than neck pain, and it might be that your nerve roots, kind of like the nerve centers in the neck, are getting pinched. Like, in other words, you got really bad arm pain or hand pain, like that's worse than your neck pain, then there is a chance that you have true cervical radiculopathy. So if you have true cervical radiculopathy, then, and you haven't been a patient, I might say, you really should get an EMG. So an EMG nerve conduction study is done at the hospital. It's either done by a doctor like myself, physical medicine and rehab doctor, or a neurologist. And what they'll do is see, are the nerves getting pinched? Much like an electrician tries to figure out where there's a short in the electrical wire. Like, in other words, they're trying to see, is the nerve getting pinched in the neck? So I would encourage people, if you're in that boat and you're not sure you got a cervical radiculopathy or lumbar radiculopathy, especially if you had a lot of care, then you might want to get an EMG nerve conduction study. So if the nerve is getting pinched, then we have to figure out, is it like a structural radiculopathy, or is it a radiculopathy that's intermittent? So is it an intermittent radiculopathy, or is it structural true radiculopathy? Give you an example. When I had my pinched nerve in my neck a couple of years ago, it was like a hot fire poker was on my hand. Like my hand felt like it was just on fire. It was on fire, and there was nothing, there was no position, there was no amount of narcotics or nothing that was going to get rid of that pain. So that's a true radiculopathy. Did Dr. Hauser get a steroid shot? No. Did Dr. Hauser get surgery? No. Did I get an MRI? I did get an MRI because, it was severe. I was basically disabled. And I had to hold my neck like this. So I did get an MRI, but I didn't have a surgical lesion. Like, in other words, what caused my radiculopathy was I was doing a lot of swimming and I was turning my head to the left. Like, I was just doing it over and over and over again. So one of my vertebrae rotated. So there's two kinds of treatments they can get for if your vertebrae is rotated. Obviously, you can get chiropractic care, manipulation, or you can get prolotherapy. So I did do some chiropractic manipulation. That got me to a certain point, but it surely wasn't resolving it. So in my particular situation, it did take prolotherapy to finally get the vertebrae to rotate and get rid of the pain. So even with true radiculopathy, if you got a nerve getting pinched in your lower back or your neck, you sometimes can resolve it with prolotherapy. But of course, there are times where you just got massive amounts of bone spurs. They're all over, they're pinching on the nerves. There is a place where you get a decompressive laminectomy or some kind of surgical procedure. But even before that, I'd really encourage people that if it seems like you do have a nerve getting pinched, that you do at least consider, going to see a prolotherapist. Now, in our office, in my office, the way I would treat it is I sometimes do nerve blocks with steroids along with the prolotherapy. Like, in other words, prolotherapy takes some time to work. So if the vertebrae is rotated and we're going to try to rotate it back with prolotherapy, then, you might, for temporary relief, do some steroid, just in the area where the nerve is getting pinched. And I do that all blindly in the office. So I, try to keep the cost down, just do it in the office. Now, so my situation, and a lot of people's situation, that's true radiculopathy. That's not intermittent radiculopathy. So intermittent radiculopathy, I also term pseudo-radiculopathy. It means that, it comes and goes. The pain may be severe, but it comes and goes. If it comes and goes, then it means that it's positional. In other words, if you go like this and you got arm pain, and you go like this and then you don't have arm pain, well, it's positional. Positional radiculopathy responds great to prolotherapy. It means that when you take a certain position, your vertebrae are rotating too much. Like, in other words, I can do, a lot of rotation on my neck and my nerves aren't getting pinched. So say if I go like this and, zoom down the arm, well, it's positional. And it means that you, compared to me, when you rotate your neck to the right, your vertebrae are moving too much. So you got to stop that excessive movement. So either you're never going to move that way, or you're going to get a cervical fusion. So most people don't want a cervical fusion. Or you're going to stabilize the cervical vertebrae with prolotherapy. And just note everything I said as it relates to the neck and the arm, I mean, it applies to the lower back and the legs. So somebody who has intermittent or pseudo radiculopathy of the lower back, it means that they occasionally or intermittently get leg pain. Then, you know, that just realize that most likely is positional, so you need to get prolotherapy because prolotherapy will stabilize the lumbar vertebrae.